Welcome to County Portal, your simple source for local government services and public records. Let's get started.
So you're turning 18 and have Medicaid. What happens now? Does it just stop? This is a huge question for a lot of young adults, and the answer isn't a simple yes or no. Turning 18 is a major life event, and for Medicaid, it means your eligibility will be reevaluated. The rules that applied to you as a child, often based on your parents' income, will change. For many people, coverage through Children's Medicaid or the Children's Health Insurance Program, also known as CHIP, actually continues until their 19th birthday, so you might have an extra year of coverage automatically. However, the most important thing to know is that your state will review your case around your 18th or 19th birthday. This is why it's critical to make sure your state's Medicaid agency has your current mailing address. They will send you paperwork, and if you don't respond, you could lose your coverage even if you are still eligible. Now, let's talk about the different ways you can keep Medicaid or find new coverage after you turn 18. First, there's a very important rule for young adults who are in foster care. If you were in foster care on your 18th birthday, federal law says you are eligible for Medicaid until you turn 26, regardless of how much money you make. This is a critical protection, so if this applies to you, make sure you connect with your state's Medicaid office to secure this coverage. For everyone else, your eligibility will now likely be based on your own income as an adult. This is where your state's rules really matter. In states that expanded Medicaid under the Affordable Care Act, you can often qualify if your income is below a certain level, which is about $20,000 a year for a single person in 2024. This means if you're a student, working part-time, or between jobs, you may still qualify for Medicaid on your own. You can check online to see if your state expanded Medicaid. You could also qualify if you have a disability that meets the Social Security Administration's standards or if you become pregnant. If you find out you are no longer eligible for Medicaid, don't panic. Losing Medicaid is considered a qualifying life event. This means you have a special 60-day window to enroll in a new health insurance plan through the health insurance marketplace at healthcare.gov. You may even be able to get financial help, called a subsidy, to lower the cost of your monthly premium for a marketplace plan. The key takeaway is to be proactive. Watch your mail for letters from Medicaid, update your contact information, and understand your options before your birthday arrives. Thanks for watching. We hope this cleared things up. If you found this video helpful, please give it a thumbs up and subscribe to our